working and living, there'll be other exams that you need to do. And sometimes the cost can be so expensive that it would be easier for you to just go to a school based in that country because it would be a part of your program already.
Miss?
So, yes?
Doesn't it take longer than a doctor to become a vet?
It depends. So my program was 5 years long, and I could enter the program straight out of high school. But if you were to go to school in the States, they may require you to do a 4-year undergraduate degree, like a bachelor's first, and then you enter vet school for another 4 years. So in total, you'd spend 8 years. But it depends on the school you want to go to. So that's something you have to consider if it's something you can really pay for, and if that's really the direction you want to go in terms of living and working in that particular country. Because when you sit your board examinations, that's something that you have to renew pretty much every year. And there's a cost to renewal. And if you don't renew it, you're not allowed to practice legally in that country. So the length of the program is a big factor in the school you choose and when you choose to go to vet school. I've had friends who took 2 years off to work so they could pay for vet school. So it's something to think about. Then you also have a lot of externships you can do or work experience. I'm working along with other clinics. Are you still seeing my screen?
No, miss.
No, miss.
Oh, okay. Tell me when it starts
what kind
back.
of medical problems does your dog have? Why she can't breathe?
It's on now.
Oh, okay. I'll explain that after. I just want to finish the requirements for getting into vet school and for what you do after. So you can do an externship program, which is basically attaching yourself to a vet or a clinic while you're in school and pretty much just keeping at it, keeping interested in the material, seeing cases. And it's very, very important, especially for people who learn by doing. So you have to learn eventually when you go through school what works best for you. How do you remember things? Is it by reading it? Is it by saying it out loud? Is it by doing activities? For me, I learn a lot by doing. So I did a lot of work experience. And even after I graduated, there were internship programs, which can be used as a stepping stone to do board certifications in other countries. Or it can be used simply just to keep your knowledge going, or if you want to work with a particular animal or in a particular area. So I knew I really wanted to work with horses. So every summer, my work experience included a minimum of 4 weeks with an equine veterinarian. And I would see medical cases, surgical cases, reproductive issues, lots of things. So I remembered a lot of that information easier when I was in school. Some things that people don't necessarily say when they talk about going into a particular professional field or going into a university degree is the soft skills that will be required when you exit your program. And those are things like your people skills. So I have friends, or I know of people who said they became a vet because they wanted to do medicine, but they didn't really like people. And the funny thing about it is you will work with people for most of your day as a veterinarian because people own these animals. You know, you go to a clinic, it's going to be somebody who brings your dog and tells you what was happening with the dog all week, or somebody who tells you why the cow wasn't eating. So being able to speak to people in a calm and respectful
Wait, miss, does the cow
manner.
actually fit in the office?
It depends, but usually if it's a large animal, the vet would go to that animal. So you go out in the field.
What if it's a calf, like a cow calf?
Then you go out in the field.
But
It all
the
depends.
person could just bring the calf inside, like the calf's small and stuff.
So some clinics don't allow that. So it also depends on which vet you call and which clinic you go to. For me, while I was in vet school, our school was a teaching hospital. So people could bring their animals to us. So we've had pigs brought into the school, but it was the owner who had to carry it in their vehicle to us. So if they had a truck and they put the pig in the back and carried it to school, then sure. But that's a very different situation. If I was going to see a large animal or somebody called me about a large animal for my private practice, I would go to them. So people skills are very important because there are people with feelings attached to these animals who will really care about them. You have to make sure that not only is the animal taken care of, but that the owners understand everything that's going on. Another big thing is compassion. So, like I said, people will get attached to their animals, and you have to understand that you may want to move very quickly doing something to treat an animal, but you have to express this in a way that they understand and give them some time. Not every case is going to be easy to fix or fixable at all. So you have to be able to relate to that person. So one story I can tell you is the dog I had before Shadow, his name was Davy J, and he was actually diagnosed with cancer. And it took a very long time.
He was what, miss?
He was diagnosed with cancer.
Is that the black and brown one?
No, I don't think I have a picture of him in this presentation. But he was a full white Shih Tzu poodle, but he was more Shih Tzu than poodle, so it's very short. Anyway, I had taken him to JSPCA and gotten the test done. Yes?
How are you gonna treat if your dog if the dog is very aggressive?
That's a good question. So
A mouth.
sometimes you have to restrain them in a way that looks uncomfortable, but it's not really uncomfortable. So we have muzzles that we can put over the mouth to make sure they don't bite. Sometimes we have to keep them on a leash and tie that leash to somewhere very short so that they can't move around too much. And sometimes we have dogs or animals that are so aggressive that we need to sedate them, which basically means giving them some anesthetic drugs that cause them to calm down a little bit and relax the muscles so that we can do work on them. So as I was explaining about my dog.
Miss?
Yes?
Which one will be stronger, a bulldog or what was its name again? I forgot. A bulldog or a German Shepherd?
Or a what?
A bulldog or a German Shepherd. Which one will be stronger?
Well, it depends. Depends on how big they are. Some bulldogs. You mean a pure bulldog?
Yes, means yes.
I think they could be equal opponents. I think so. It all depends. Every dog has its day. So just to briefly wrap up my story about my dog, I went to JSPCA and had vets who I had known for a while look after him. And, you know, they really took the time to explain to me what was going on. I had learned about it in school, so I had an idea. But it was a very emotional experience to see my dog so unwell and know that it wasn't something that I could really cure. He was just going to be in pain, and we had to decide how we were going to handle it. So I've been on the other side as an owner and really appreciated the time that someone took to explain things to me and the compassion they had in explaining
How old were
everything.
you when your other dog died?
It's a good question. I think I was 19. And that
So
was my
how
first
old were
dog.
you when you got Shadow?
I was 22.
Okay.
So yeah, it took me some time to get over my first dog. But yeah, another important skill now is time management. So you may have a schedule for the day of what's going to get done, and you have to know how long a certain case may take so that you don't overbook yourself, as well as that if there are any unexpected situations that develop, that you have enough time to look at it. And one thing that's really important as well is what we call triage. which basically means how you rank particular cases based on how critical the patient is. So if I have a dog that comes in and wants to be vaccinated, and I have a dog that is unresponsive, it's not eating, it's not drinking, it's not moving, or a dog that's having seizures, then those cases would take priority over a vaccination, because time-wise, it's critical that they get the attention now to ensure that they survive. So time management is a really important skill that you will need as a vet. And even just in school, you'll have to learn how to study all of this information about so many species and pass the exams. So you'll always need that. Ethics are also very important. You have to understand what's going to be fair to the animal, what's fair to the owner, and what's fair to you, and treat the situation likewise. And you can never ever stop being determined. You have to be determined in your studies. You have to be determined in your practice, that you will be able to learn what you need to learn and look after all of these animals, because someone is putting their animals' lives in your hands. It's a very, very, very serious thing. You have to be ready for it. So it takes time to build that confidence and that determination, but once you have it, always keep it. So you spend all this money, you took all these exams, you went to this school far, far away, and now you want to know what can you do with your degree. So you could work in a clinic like JSPCA. Sorry?
Was that a leatherback turtle in your hand? In that hand right here?
You tell me. You know how to tell your turtles apart?
Well, leatherbacks have those like 5 lines.
Mm-hmm. Keep going. What else is special about leatherbacks? You know any other leatherback facts? Anybody hearing me? Did we get disconnected?
No, miss.
No, miss.
Oh, you can hear me still. Okay, good. I was asking if you know any other leatherback turtle facts.
No, miss, I don't.
No,
Okay. So this was a turtle that I found at Dolphin Cove. It had washed up, and I had asked everyone what kind of turtle they thought it was, and eventually I got the answer, hawksbill. So if you're really interested in turtles, you can look up hawksbill turtles and leatherbacks, and you can look at what the differences are. But yeah, you can tell the differences based on the number of ridges that they have in their back and the number of rows on the what we call the carpus, which is basically that outer shell on their back that you see. So you can work in a clinic like JSPCA. You can work on a farm, which would be out in the field. You can work in a shelter practice like Montego Bay Animal Haven. You can have your own private practice where you do house calls, which is what I do. Or you could work in a zoo, an attraction. You could be a teacher, a lecturer at a school, or you could lecture in some animal program that's not specifically in veterinary medicine. And you also have options in the government. So on this screen, below the turtle, there's a picture of me at my school. I think this was my final year, sitting with one of our patients. So this was in our surgical facility. He had just had...
Dr. Simone, Ariko
Yeah?
is supposed to present afterwards. So I'm just asking if you could wrap up.
No problem.
Okay.
So, right, that's a picture of me when I was in school. The picture on the far right, the one with me in blue scrubs and a black dog. So that was in our recovery ward. She was really cold and she would only stay still if she sat in my lap. So that's where I stayed for about 3 hours. And then in the middle, we have a pigure of a loggerhead turtle. And that was a big important project that I worked with with a government organization in Trinidad called Turtle Village Trust. Sorry, a non-governmental organization called Turtle Village Trust. And basically, we had this turtle that we eventually named Sammy, washed up on the shores because she was sick, and we rehabilitated her for about 4 months. And then we released her. And it was such a rewarding experience, knowing that she was so unwell and she couldn't eat. That's how she ended up floating ashore. She wasn't able to sink herself enough to dive. And it was one of the best experiences I had working with that association in vet school. So there are a lot of opportunities you can have as a vet to work anywhere in the world with any animal. So don't ever limit yourself. On the job, there's some things you can expect. The figures here are very rough. But if you're working locally in Jamaica, anywhere between 150,000 to 500,000 per month is what you could be making, especially at an entry level. This will vary based on if you're in private practice, if you are employed by the government, your years of experience, and it can go higher than this as well. Versus in the States, where you can make easily twice as much at the same entry level. So it's up to you. You choose where you want to work, and you also choose the type of work you want to do. Your hours will vary based on where you work. So clinics may open from 9 to 5. They may have emergency hours. They may close on a Saturday. It's all up to where you're employed. But generally, you're working a full day. And your experiences, there will be great cases that are easy, and there'll be difficult ones that you can't figure out what's happening, and it will take you time. You'll have to ask your colleagues. And there will also be very sad experiences that you have to prepare for, such as cases where animals may unfortunately die or have to be put to sleep.
Oh, Miss, leatherback is the largest turtle.
There we go. So there's a lot of variation in what the role, the job of a veterinarian can be, depending on what you choose to do with it. So for me, the most rewarding things are having a healthy animal, an excited, happy owner, and learning something from my interaction with them, which is also why I intend to work with a lot of species for as long as I'm around. So did anybody have any questions really quickly before I have to wrap up?
What medical problems with your dog? Why you can't mate?
So, briefly, because I said he was a rescue, we didn't have any history on this dog. I realized when I came home that he only had one testicle that had descended into that sac that hangs. You know what I'm talking about?
Yes, miss.
All right. So there was only one. They're supposed to have two. So it's very possible that if he is mated with another dog, then the offspring could have that same condition because it's tied to genetics. And that can cause them to have a lot of other medical problems, especially when they're older. It can become cancerous. It could obstruct, depending on where it's located, the testicle that hasn't descended. It could cause obstruction in the digestive tract.
So miss, what happened to the testicle that your dog didn't, what happened to the testicle? So did you find out where the testicle was when that didn't descend with your dog?
If I found where the testicle was, yep, yeah. I did. I can feel it.
Where was it?
So it's what we call in the inguinal region, which is basically in the groin. So between where the legs join the rest of the body, close to the hip. So I can feel it right there. Sometimes it's much further up, or sometimes it doesn't develop at all. But because we know that that's a genetic problem, I wouldn't want that to continue if he were mated. So that's why I wouldn't mate him. Anybody else have any questions?
Well, it's kind of sad that you just get to continue his family.
It is. I heard someone else with a question.
Yes, miss. So if you're going to do a surgery on an animal, how do you know where to stop and know if too much blood will come out?
That's a good question. So something we do when we're going to do a surgery is we do a pre-surgical assessment. And that includes things like taking blood, so we know how much blood they have, how much red blood cells, hemoglobin, all of those things. And another thing we do is we assess the size of the dog and any other medical conditions they may have. Also important is knowing your anatomy. So you'd learn that in school. You'd learn where all the organs are, and you would be able to kind of map that out in your mind when you're going to do a surgery on an animal. Also, there are lots of other tools that we can do. So we can take x-rays to figure out where everything is, and we can take measurements on the x-ray to match what the measurements on the animal in real life on the table would be. So we would know that the stomach is 4 inches on this side and it stops 10 inches down from there. So then we'd make our incision, or we cut through the tissues at that point. And they're basic surgical skills that you would learn about how to stop bleeding that we would use in the surgery, as well as techniques to use to prevent excess bleeding. So things like the type of blade you use, the type of suture material you use, how far you cut, and we also have suction tools that remove blood. And also while you cut, you can be tying off your blood vessels, which is where the blood would be coming from, so that it doesn't block your view in the surgery and that they don't lose blood.
Thank you.
You're welcome. Anyone else? No? All right, so the last thing I want to leave with you is a very important saying from one of my favorite authors, Paulo Coelho. And it says, there is only one thing that makes a dream impossible to achieve: the fear of failure. So as impossible as whatever field you want to get into may seem, the only person that will stop you is you. You can't give up on yourself. So as long as you are consistently...
Wait, miss.
Yeah?
So your friend that said she didn't want to see blood, what happened to her when the first time she saw blood?
She fainted.
I thought so.
And she went into law school.
So now she's a lawyer?
Yep. And she's happy with it. So yeah, don't let anything stop you from achieving what it is you want to achieve. Once you decide you want it, just make a plan and go for it. So go
Wait,
for it,
so what
everyone.
if she sees her own blood?
I don't know what she do. I really don't. If I see her, I'll ask her.
Okay,
so I think that's all I have in my presentation. So I challenge you all to think about what it is you really want in life and be great at it.
I learned a lot.
Yes, Dr. Simone, thank you so much for your presentation. It was very informative. As Jumin was saying, we definitely learned a lot. It was very thorough, and I'm so glad that you're encouraging them to, you know, really take time to actually see what their interests are, what they actually like, what they're passionate about. That's very important. It's never too early to actually start thinking about those things. So thank you so much.